Thank you, Allison. It's great to be here today, and pleased to be joined by our colleagues over in the new School of Medicine at BYU. Again, my name is Michael Stark. I'm the Associate Dean of Research in the College of Life Sciences at BYU. Brandon Webb is my counterpart over in the new School of Medicine, and we've gotten to know each other a little bit on the University Research Council, and of course, Dr. Mark Ott, who's the inaugural Dean of the BYU School of Medicine. The School of Medicine was announced, correct me if I'm wrong, Mark, but it was announced in July of 2024, I think. And then shortly after, in that same fall, Dean Ott was announced as the inaugural Dean of the medical school. And we at BYU, when the announcement was made, those of us who were faculty or administrators there felt the earth shake, and it's been an impactful thing for our community, and we think it's going to be an impactful thing for Utah in general to have BYU School of Medicine with its unique focus there. We'll dive into a few questions here so we can learn more about it, Brandon and Mark. First question I have for you, Mark, is could you just briefly tell us about what excited you most when you were first tapped as the dean?
Was the unique nature of how it all started. This started with an announcement by the First Presidency of the Church of Jesus Christ of Latter-day Saints. When I was given the privilege of doing this, it was meeting with that same First Presidency and seeing the vision that they had for this, which was far beyond just a medical school. It was about blessing people throughout the world. And, nobody would ever complain about that opportunity in a lifetime.
Thank you. Brandon, same question. Your more recent addition to the team here. What excited you most when you were tapped for this position?
Working with Mark, of course. Same sentiment. Deeply humbling to be part of something that is that has the potential to have a global impact, and also just really exciting to be in the BYU community and to be able to take advantage of the great things that are already happening at BYU. And to partner with a tremendous number of people around the state who were already helping to build the framework and the foundation for the school.
Awesome, thanks. Mark, I know that a lot of your team's initial work was focused on preparing accreditation proposals and so forth. Tell us where you are now and the key efforts currently consuming your time and that of your team.
Sure. So accreditation is the underpinning of a medical school and any organization in that somebody has to say you're really in the club. And with medicine, it's the Liaison Committee on Medical Education, the LCME. And that journey usually is a journey of many years. And because of the great people that we were given and that we found along the way, we were able to accomplish in 8 months what normally takes 18 to 24 months. And so we turned in the documents last July that were about 900 pages that are required. And we found out after that we had achieved enough of progress at that point to become candidate status. And so we have a site visit coming up in June. And that will be reviewed by the Central Committee of the LCME. And then in October, end of October, first part of November, we'll find out hopefully that we've achieved preliminary accreditation status, which then allows us to select students for potentially the 27-28 academic year. So that going from really January of 2025 to potentially having students in the summer fall of 27 would be miraculous.
That's awesome. It's kind of been great to watch it from afar. You've stolen a few of our faculty to become part of your faculty, and we're actually excited for that. We're excited for them to be there and for us to have good connections between the life sciences and the School of Medicine. So that's great.
We try not to look at it as stealing, but it certainly would be perceived that way. It's just the bench is so deep at Brigham Young University and, to be honest, around the country that we've had wonderful people apply for the positions.
Yeah, no, it's great to see. It's great to see. Brandon, a little bit of a longer question here that I'll let you answer as we dive in a little bit to the research and innovation plans and thoughts for the School of Medicine. The initial press release for the School of Medicine stated, quote, "The BYU Medical School will focus on teaching with research in areas of strategic importance to the church, with a major focus on international health issues affecting members of the Church of Jesus Christ of Latter-day Saints and the church's worldwide humanitarian efforts. What is your vision for research?
That was a long question. uh, and a good one. There's some very unique features to that, and like Dinot said, this is really important to us that the School of Medicine was announced by our sponsoring organization, the Church of Jesus Christ of Latter-day Saints, with specific direction to be different, to be unique in certain ways. And some of those ways are captured in that press release. Number one is that it's a student-centered medical school. The focus is on teaching and training top quality physicians who not only are prepared to be competitive in their specialties, but to also have impact and benefit around the world. And to that end, the entire research program is designed around the students, starting with a required research curriculum that they participate in throughout their entire medical education, that immerses and grounds them in critical thinking and analytical skills, but with that global health focus. And when we talk about global health, we take it literally. Global means the entire world, not just low and middle income countries. We're talking about outcome disparities everywhere, wherever they may be, domestic or abroad. So that's the first thing I would highlight is very student-centric. We're leaning into curriculum and student training. The second is impact. Everything that we want to accomplish with the research program is oriented around having meaningful impact, benefiting the world. And to that end, much of what we're going to be doing in the research program at the School of Medicine will be applied or implementation or translational so that we actually see the impact. We think that there's a tremendous amount of discovery that's already being done and done well elsewhere. And we want to be a vehicle for implementing that discovery.
Yeah, awesome. Thank you. As you're talking, I was thinking about some, since I've been in my position just a few years in life sciences, there have been technologies that have come out that I've seen that have a potential to be an impact on the world, such as particular innovations regarding salty soil and how to grow crops better there, and other things that could have a big impact on the world. So I appreciate that insight. Brandon or Mark, maybe Mark, you can start with this one. What are some key needs within the School of Medicine, or even within Utah's healthcare network, where you see an opportunity for Utah's biotech industry represented here to help?
The one of the sad things that, as you know, that's going on right now are a number of wars and conflicts, and it's amazing to watch the technologies that are involved and the incredible accuracy, destructive power that's on our phones and on in the news. And it's a shame to see billions of dollars of technology blowing up billions of dollars of technology and killing people and damaging infrastructure along the way. There's what this group does is the opposite, the antithesis of that, of doing things that help create life and sustain life. And that is our mission in the School of Medicine. And we will have, limitless encounters with wonderful people, both here and around the world, where the devices, the technology, the processes that we can envision and that you can create will do exactly what this world needs, which is bless lives and help people. And the genius that's out there among you and among the whole world is staggering, but it's a shame to see it just being destructive.
Brandon, any additional thoughts on that?
Yeah, I think Mark had mentioned this earlier, but the bench is so deep. We've just had so many people express interest and willingness to pitch in. So many that we actually are too immature right now to actually engage with all of you yet. But that's actually one of the things that excites me the most, is that the potential is so deep and so broad for bringing some of these technologies to bear in a beneficial way, that we couldn't be more excited to work with the biomedical community in Utah and elsewhere to take those great ideas and put them to work.
Appreciate that. I know that, again, you're just hiring faculty. You don't have any students on board yet. You're talking about building a building, all these kinds of things. But it sounds like you have some vision to look forward to collaborating with the biotech community, particularly on innovative solutions that can benefit the world and really make a difference globally. And I think it really can represent a strong partnership. Speaking of partnerships, you know, in my limited view, I always looked at the University of Utah Medical School as kind of the only place where medical training was happening in the state of Utah. But I know that in Provo, things have developed kind of quietly and slowly with Norda College of Osteopathic Medicine. You have Rocky Mountain that's training a lot of practitioners in different areas, and now bringing on BYU School of Medicine. Mark, how do you see those entities, and even additional? I mean, the Huntsman Cancer Institute is building a cancer center down in Utah County. In Lehigh, there's the Primary Children's has that hospital there. How do you see these entities, and particularly the School of Medicine, impacting Utah's healthcare industry over time?
Well, I mean, Utah is fortunate in that it really began centered around the University of Utah and the great, research, technology, and healthcare environment that they created. And as wonderful and as great as that was, it didn't meet all the needs. And so from a manpower standpoint, there were still lots of young women and men who wanted to go into medicine who couldn't. There just weren't enough slots, certainly not here in the state, but even around the country. And so the osteopathic schools appropriately started filling that gap and creating more slots for more young men and young women to train in medicine. And they've been filling those additional slots. Brigham Young University created a medical school not because it needed another medical school, the church did this, but because there's something about this one that's different. Everything that happens, and you would be very familiar with this, is because a need is not being met. And when somebody is smart enough and creative enough to meet that need, they will always succeed. And so the School of Medicine at BYU is really meant to meet a need that is increasing the number of medical practitioners, of course, but a different kind of medical practitioner that will meet a need that is not met by other schools of medicine, both in this country and around the world. And that's really what our charge is. And so in working with great researchers, great biotechnology companies, we're going to bring things out that have not been brought out before. And we will partner with people and organizations who can help meet that need that's not met. There is just so much need in this world.
Awesome. Thank you. Brandon, anything to add to those comments there? Great. While you were talking, I was reminded that one of the key collaborations that has been talked about and introduced for the BYU School of Medicine is the potential and real collaboration with Intermountain Healthcare. And I've, over the last couple of years, I've been working with one of the groups at Intermountain Healthcare to create some collaborative opportunities between our life sciences faculty and the researchers there at Intermountain Health, including tapping into the large amount of data they have and samples that they have. And we're kind of on the cusp of developing a research proposal and plan to look at some of that in the cardiovascular space. I wonder if you have insights on how that collaboration, and maybe we can start with Brandon and then Mark, how that collaboration with Intermountain Healthcare and BYU School of Medicine can really enhance discovery in healthcare space.
Yeah, that's something I'm really excited about. Having worked at Intermountain for the last 12 years as an investigator and practicing physician, there's a lot of opportunity to take the principles of population health and outcomes improvement and quality improvement that Intermountain has really leaned into in its research program, and the data warehouse that they have, and create partnerships around that will allow us to ask maybe creative questions that haven't been asked before, or probe lines of inquiry that haven't been explored before because those partnerships didn't exist. And we're really, really excited to nurture that relationship with Intermountain Health.
Great. Mark, anything to add?
Yeah, I would add that, prior to coming to Utah 25 years ago, I'd spent my training and my career in Boston at Mass General and at Harvard, and prior to that at Hopkins for 8 years. And those were wonderful institutions. And I can remember when I accepted the position to come to Intermountain Health 25-ish years ago now, I was talking to the chief of surgery, Andy Warshaw, and letting him know that I had accepted this. And he looked at me like, why in the world would you do this? You couldn't be in any better place than you currently are at Harvard and at Mass General. And while that seems apparent, what I've learned in the past 2+ decades here is that there were things that I got to do here that I would have never been allowed to or had the opportunity to do in Boston and at Harvard. And I don't regret those decisions at all, because the people that live here are phenomenal. The opportunities that are here, the data that are here, it was just limitless. And it changed my life, and it allowed me to do things that I love to do. And so Intermountain Health is a great resource. And all of the healthcare entities here they have so much untapped potential that you can't go wrong. One of the great things about medicine is you can't go wrong because there's so many things that are done so poorly that you can improve every process. But it's the same thing with the resources that exist here. So many of them are untapped that you can't go wrong because every one of them has gold underneath the surface.
Awesome. Thank you. One thing I want to do is at Brigham Young University, we have a high focus on our students and incorporating and engaging students in all the things that we do in the research lab or in the teaching classroom and so forth. And one thing that I've been excited about that's relevant to the folks at this summit is the way that we in life sciences have been able to gauge at least a small number of students in the bioinnovation space, connecting them with Mark Paul's Bench to Bedside program, for example, or other areas of bioinnovation. And I know that you have that focus too. I've heard it and I've seen it in your emphasis that the vision is on student training and the focus on students. Maybe Brandon, start with you. What's your vision for involving students in research and innovation in a way that benefits them, but also allows them to be inspired in their creative process in developing new tools and innovations that can really help medicine?
Yeah, I think we sometimes forget, because we think of students as young in their career or trainees, that some of the most game-changing discoveries have actually come because of ideas that students had. And they didn't have the ability to mature those ideas, but the ideas, the looking at things with a fresh view, is something that students do extraordinarily well. And there have been Nobel Prize winning discoveries from medical students, Barry Marshall and the H. pylori, for example. So we actually are really, really excited to make our students full partners in the research process, and to pair them with talented mentor investigators, some of whom will be at the School of Medicine, some will be at BYU main campus, and many of whom will be elsewhere, and will be able to help incubate and nourish those ideas. And I'm excited to see what happens, because those students are coming at this having grown up in the world where there is limitless potential, but there are a lot of problems to be solved.
Great. Mark, anything to add there?
Yeah, I think one of the great tragedies of our world is that at any given time, there's got to be at least 50 to 100 people that are kind of Einstein level in terms of intellect. And yet, unless they have the opportunities and the right circumstances, they never come to the fore. And I think one of the things that BYU does through its pathway programs and other things, it gives young students, young people, the opportunity to gain an education. And we have, through that and other mechanisms, the ability to identify these diamonds in the rough. And I'm excited to find people all over the world that will be students who, if given the chance, will do phenomenal things. And I think that's one of the unique parts of our mission, is we have access to a talent pool that nobody else would have had.
Great, thank you. We've got just a few minutes left, and I will ask you each to provide any last comments or ideas that you have for this conference. But because we have a little time, I want to allow anyone that has a question to raise your hand, and if you have a question for Mark or Brandon here and about the School of Medicine at Brigham Young University. Okay. Do I see one? Yes, please, JC.
I'm happy to start with that from a research standpoint, and I'll start with a challenging fact. About 9% of all biomedical research dollars benefit populations outside of the highly resourced areas. In other words, the 90-10 rule is something that's talked about in global health a lot. 90% of biomedical research, funding, and innovation benefits 10% of the world's population. 5 billion people around the world lack access to high quality surgical care, and 55% of mortality around the world is addressed by less than 10% of all biomedical funding. In other words, we have huge opportunities when we look outside of our normal sphere of influence. If we look outside of where traditional biomedical research has impact. And those opportunities for innovation lie at a really interesting inflection point between where we know what works and what's actually working, the evidence to outcome gap. So for us, when I think about what we're aiming to accomplish on a global scale, it's closing that evidence to outcome gap. And when I think about innovation, that's where the best innovation happens, where there's a disconnect between what we know works, but what we're actually seeing. And that innovation is blowing up with digital health, with 3D printing, with molecular diagnostics, with innovations that implement and bring supply chain to the people that need it most. There is just, again, an unlimited possibility for doing more than just impacting that 10% of highly resourced world population.
Mark, anything to add to that? That was pretty good.
Yeah, no, it's great. I mean, you can see why Brandon was one of our first hires. And we're, again, grateful for Intermountain Health, who has given us part of his time. We want our students to fall in love with people in need. And the best way to do that is to start from day one and not say, I'm too busy, I need to learn this, I need to finish my residency, I need to do this, I'll do this when. We need them from the very beginning, and our curriculum is designed to do this, to be learning about healthcare here, but also in the world, but specifically learn about people and spend time with people that don't have all the resources they have. And when you do that, and you can contribute in a way that they want and that is beneficial to them and their community, you will naturally fall in love with those people. And you will have a desire for the rest of your life to keep going back and serving and helping. And that's what we're designing in the international area. It's not just about bringing people here to study. It's about becoming part of a world community and not just focusing on me becoming a great physician.
Thanks, Mark, and thanks, Brandon. It reminds me of some of the words that Dean Bridgewater said this morning in her welcoming comments, that BYU really is about working with students and faculty and others on campus and beyond to have an impact on a world we wish to improve. And it sounds like the School of Medicine is really elevating the campus's efforts in that area with its international focus. Any last questions before we, yes, please, Kelvin.
That's a really good question that I'm going to punt to my elder here, Dean Otten. I'll answer from my perspective. We are different, and we do look different. There's not the BYU School of Medicine early on, again, is entirely focused on first accreditation and second developing a robust medical education environment for the students, and only third developing a robust research program, and that to, again, impact and benefit the world and to develop students. So we are going to look different. We don't have halls and halls of wet lab space, but we think that our people are our best asset, not our laboratory personnel or our federal funding. That'll come with time. Right now, we're recruiting strategically individuals who fit specific medical education needs and faculty who have been prepared over the course of their careers to do things in the unique space that the School of Medicine is going to focus on.
When I was first meeting with the First Presidency with my wife for about an hour, in that conversation, President Nelson, President Oaks, and President Eyring, separately in that hour, each emphasized the importance of research. It was not an afterthought. It was not one of them liked it and the other one didn't. Every one of them separately in that conversation brought up the importance that research would play in this School of Medicine. And I just, that to me said this was important. This was core to the mission, and that the research will make them what they need to be. And President Nelson just, at one point, he was talking about the future, and he talked about the impact that this School of Medicine would have in the coming decades, that it would far exceed anything that we could imagine now. And I knew, listening to him, that was him seeing something in the future that I couldn't see. But I'm going to live 20 or 30 years because I want to see the fruits of all this beginning, and I know that there's great things that are ahead. And that does involve research.
Thank you. That's a powerful statement at the end. Mark or Brandon, any last words? I really appreciate you guys being here and sharing your thoughts and sharing some of the ideas and insights into the School of Medicine. Anything else you'd like to say to this crowd today? And
I can't add much to that, but I would close with an invitation, an open invitation. I'm coming from a very different place. I spent most of my research career focused on improving our ability to personalize care to patients who need it, who are at highest risk of disease or who are more likely to have poor outcomes, and use technology to do that. And now I'm pivoting and having a wonderful time exploring how those ideas and that training pivots to a bigger scale. And we've got so many talented investigators and innovators here and throughout the university community. And my invitation is think broadly. Think about the global scale. Think about those gaps that we talked about, and let your talent and your ideas start to wander towards a bigger potential for impact. And as that happens, please reach out. We'd love to explore where we can partner.
And I would just say that this morning I was reading in the Old Testament about the story of Joseph in Egypt and his life, and I was struck by the fact that that's who we're meant to be, in a sense. It doesn't matter whether Joseph is tending sheep, whether he's in Potiphar's house as his head steward, whether he's in a prison, or whether he's in the court of Pharaoh. Everything that Joseph touched prospered because he was doing it with the Lord. And that's what, and I realize that's a religious belief thing, but I feel that way. What we're doing is with God, and because of that, we can be prospered like he was.
thank you, Brandon. Thank you, Mark. We are really excited I'm excited to have you as a colleague at BYU, and excited to look forward to the collaborations that we'll have innovating and solving some of the world's toughest problems. So thanks for being here, and thanks everyone for listening.